Hey everybody, I'm here with Dr. Jonathan Hall, a board certified plastic surgeon in Massachusetts. You can find him at drjhall.com. So we're here to talk about cosmetic surgery and some of the procedures available there at his practice. So Dr. Hall, thanks so much for joining us today. I really appreciate it.
Thanks, Caleb.
Yeah, absolutely. And I wanted to just start off asking how long you've been working as a plastic surgeon.
So I've actually been in private practice since 1990 right here in Massachusetts. So 32 years.
Awesome. Yeah, it's good to hear. Was there anything in particular that really drew you towards that field?
Well, that's a really good question. So my mom was a musician and my dad was a research physicist. So I grew up learning to love the arts and science. And we had a family friend one day when I was 16 who was a plastic surgeon, and he had been a psychiatrist in the Navy and then decided that he really wanted to do something more. And so he called plastic surgery physical psychiatry, where you helped how people felt about themselves by changing the outside. So he said, look, he says, you love art, you love science. This is a great way to use those things to help people. And so I thought, wow, that sounds really cool. And I looked into how long it took to become a plastic surgeon. I thought, oh boy, that's a long time. Maybe I'll do something else. But in high school, senior year, they give you an interest survey to kind of tell you what you're ideally suited for. And I opened up my envelope and all the lines crossed over being a physician. I actually looked around the room like, really, is this like candid camera or something? But I actually went off to college with the idea that I wanted to be a plastic surgeon, and just kind of straight through. Here I am years later. It gets me out of bed every morning. I love what I do, and I really enjoy using my skills to help people feel better. I look at plastic surgery as correcting deformities that people have, whether it's an aesthetic deformity or we'll talk about today if men have breasts, things that bother them, and can help to improve their body image.
Definitely. Yeah, I can imagine that would be really rewarding to be able to, create something for a patient and really just get them those results that they're looking for.
Every day we get to change somebody's life and make it better. So that's really very cool.
Definitely. And I was curious to find out from you with the pandemic, the lockdowns and everything. Did you guys notice a real decrease with the lockdowns? And then once those were lifted, did you guys see a big increase in patients coming back in?
Yeah, so I never shut down. We kept our employees fully employed, and I still had patients. I take care of patients that have skin cancer as well. And so I had patients that had things that just couldn't wait. So we were still seeing one or two patients every day and doing what we could to help them in the office. So it was tough getting through the pandemic. But as things eased up, I think that we had the same experience other plastic surgeons did, where it actually was a lot busier. So our numbers have gone way up for that.
Okay. Yeah, definitely. That's good to hear. And with some of the procedures that you really focus on there, what are some of the main ones that you really enjoy doing and that you see a lot of?
Well, I do all plastic surgery of the body, breast, and face, and honestly, I like any procedure that we do that makes somebody better. I know it sounds kind of silly, but if somebody comes in and we make them better, it could be as
Sure.
simple as having a woman that feels older and some Botox and fillers, and she feels better about herself. There's a saying that aging is a thief that steals your beauty away a little bit each night, and when you can help those patients that are good, we see a lot of women mostly, but I see a lot of men for procedures like gynecomastia, and men don't like having breasts, and they want to feel normal.
Sure. Yeah, definitely. And so with the procedure, can you explain a little bit more about, what typically happens with that and, how that works?
Yeah, so gynecomastia is interesting. So there was a doctor that did some studies and showed that as many as 35% of young males at the time of puberty will have some breast development, but in most cases it goes away. But if it hasn't gone away by 18 months, it's probably not going to go away. So I'll see people that come in that they may be in high school, they don't feel like they can change for gym class, shirts versus skins. They wear extra shirts to kind of camouflage their appearance. And I found that no matter what someone's orientation is, the men don't like having breasts. And so there are three kind of main categories. If somebody comes in and says they started developing breasts at the time of puberty, that's usually idiopathic, which is just a fancy medical word for we don't really understand why, but that's the most common cause. If someone comes in and says I started getting breasts at the age of 16, Then I'll say, did you smoke a lot of pot? And they'll say, well, yeah. And so a lot of times that's the cause for that. And somebody comes in and says, I got gynecomastia 18, 19, and we're weightlifters. I'll say, well, were you taking some supplements? It doesn't necessarily have to even be the illegal anabolic steroids. Sometimes some of the health food store supplements have enough in it that it will cause breast development. So, and they don't have to be on that for very long. And people come in and say, geez, I've got these breasts and they're embarrassed by it, and they don't like to see the pushing through their shirt, and they want to be able to take their shirt off at the beach and feel normal again.
Yeah, definitely. And so with the procedure, are the results, permanent with that, or what do patients need to do to really maximize those results?
Yeah, so the results of surgery are permanent. I have one unusual patient that gained. He was in his 40s. He gained 30 pounds after surgery, kept smoking a lot of marijuana, and grew some breast tissue back. But that's one people in 32 years. Generally, once you remove that tissue, it does not come back. And so the surgery takes about 2 to 2.5 hours. We do it under general anesthesia at an outpatient surgery center. People are home very shortly after that. People generally take that first week off from an office type job and 6 weeks without any strenuous physical activity.
Okay. And so it's more about, the patients making sure that they maintain a healthy weight and then just staying away from those other risk factors for developing that again.
Yeah, but I have patients that continue to smoke pot or continue to be bodybuilders, and once we remove that tissue, it generally doesn't come back. I think if somebody gained a lot of weight, they could get what's called pseudo gynecomastia, where they have some fat in their chest, but we've usually removed a lot of that, so they would tend to gain weight in other spots if they gain weight.
Okay, yeah, that makes sense. Is that just because you remove those fat cells, and so then they're going to be, it'll be going somewhere else afterwards?
Yeah, that's usually the way that works.
Okay. And then, so you mentioned the surgical time with that. What's the typical, recovery time with that procedure?
So most patients, so it's important. I tell my patients that we're a team working together. So recovery is a couple of things. One is how long are you taking pain medicine for? How long before you can go back to work, and how long before you can go back to the gym? So it's important that people kind of follow the rules afterwards to get a good result. And with gynecomastia, that means not working out and wearing a compression vest. So we have a compression vest that we order that they'll wear, because when we've removed all the tissue with liposuction and excision, that area has to get healed back together. And if they're moving, fluid builds up in little spots and it can kind of contract and not heal well. So it's important to wear that vest. But I would have to say we have a new enhanced recovery after surgery protocol we've been doing for about 10 or 15 years, where we give patients special medications just before surgery, and then during surgery I use some other special long-acting local anesthetics and some things that cut down on bruising. And probably 70% of patients only take Advil after surgery, and probably 95% of patients by a day are only taking Advil. So it kind of feels more like they've been working out hard with a little bit of soreness of the chest, but not bad. But they, if somebody has a very physical job, if they're in construction, for example, they've got to take 6 weeks off from doing that. But if they have a desk job, they're back working after a week. If they work remotely, they can be back working after a couple of days usually.
Yeah, it's really not too bad. And, the pain level sounds like it's pretty tolerable with that.
Well, I think it's a combination of the new techniques that we have and the new long-acting local anesthetics and those things together, but it's tolerable. And I do give patients a prescription for a narcotic, and because if you bring an umbrella, it never rains, so you have something just in case. But I find that for most patients that just Advil, and Advil is kind of an interesting medication. They did a study in women who had hysterectomies. They showed that ibuprofen, Motrin, and Advil worked as well as morphine for pain after a hysterectomy, which is kind of pretty surprising to a lot of people. So we try to get people on that after surgery, because it doesn't make you sick to your stomach. It doesn't make you dizzy. It doesn't have all the side effects that a narcotic can have. And a lot of my patients are really happy not to have to take a narcotic afterwards.
Yeah, definitely. And so you mentioned that the technique and the way that you do the procedure helps with, not having as much pain and recovery on that.
Yeah, I think that it's not just unique to us, but there's a trend in the surgical world. We call it enhanced recovery after surgery protocol, or ERAS. And so we'll give patients some Tylenol and some Celebrex just before they go back to the operating room, and then during surgery, the wetting solution we use has some local anesthetic in it. Then there's a medication that cuts down on bruising called tranexamic acid. And then I'll inject some Marcaine, which is a long-acting local anesthetic. When you block the early pain, people tend not to have as much pain even days later. So those things all together kind of add up to greater than the whole. There's another technique which is I've been using about 15 years. It's they call it safe liposuction, which is separation, aspiration, and fat equalization. And we basically go in and break up the fat first with a cannula that has fins on it. If you use power-based liposuction or energy-based liposuction, such as a laser or ultrasound-based liposuction, it can damage the fat cell. And so those fat cells that are damaged can leave denser irregularities. If you use power-assisted liposuction, where the cannula gets moved back and forth in quick cycles with a power handle, it breaks up the fat mechanically, but those fat cells are still alive, they're still healthy. So in my hands, it allows me to be the most aggressive, because patients want a flat chest. They don't want to have any residual. And so it allows me to be as aggressive at thinning that area as I can without tending to leave dents and irregularities. And so mechanically breaking up the fat. Then when we go back after the liposuction and we excise any breast tissue through an incision around the areola, and then we go back and smooth the fat. And so between those things, the fat cells that are left are still viable, and they can get kind of molded into a nice smooth layer. So that has worked better in my hands than laser liposuction or vasor liposuction, neither of which will remove breast tissue, and both of which can cause dents and irregularities if they're not used properly.
Yeah, that makes sense. And so when you're talking about breast tissue, do you just mean the excess fat that's there, or is there, extra that's there that needs to be
Well,
removed?
so when men and women have tissue on their chest, and if it gets stimulated with hormones, those cells can grow into breast tissue. So I take care of a lot of women, and their breasts can be, as they get older, can be fattier. As they're younger, they can be denser with more real fibrous breast tissue. And men, it's the same way. Some men, their breasts are fattier. Most men have a component of breast tissue as well as the fat, so it's fat and tissue. So you can't remove breast tissue with liposuction, which is another reason why cryolipolysis, which is known as cool sculpting, doesn't always work as well for gynecomastia, because it may make fat get better, but it doesn't remove breast tissue. So there's usually an area of breast tissue that's maybe the size of between a peach pit to a golf ball or bigger underneath the nipple area that will not come out with liposuction, that I'll actually excise through an incision halfway around the areola, where it heals very nicely and it's difficult to see the scar, in addition to the liposuction. The liposuction is important in my hands because, in general surgery, we were kind of trained to go in and with a pair of scissors and try to kind of carve out the tissue, but it's really hard to get an even, smooth surface when we do that. Even if someone doesn't have a lot of fat, the thinned cannula, the safe technique, allows us to kind of separate little tunnels around that area of breast tissue, so that when it comes time to remove it, it's very easy to kind of remove it without damaging the skin on the outside.
Okay. Yeah, that definitely makes sense. And what do you look for when you're trying to determine if a patient's going to be a good candidate for that procedure?
Well, so again, it's teamwork, right? Who do you want to be with you on your football team or some other team? I have to have a patient that wants to get better, but wants to follow the rules afterwards. I have a patient that was a football player at a university 3 hours away, and he didn't wear his vest and he didn't rest afterwards, and so he got a fluid collection called seroma and had to drive back to my office every week for 6 weeks to have fluid drained off. And that just doesn't happen when people kind of follow the rules. So I think that someone that has realistic expectations. I think the better skin elasticity someone has is helpful. So younger patients can have an almost perfect result where they can look like a bodybuilder, with an oiled chest. When people get heavier or their skin's not as elastic, or people that get to be in their 40s and 50s or 60s, I can make them better, but their skin's not as elastic. And you can't really tighten loose skin without taking a piece out. So to put a visible scar on the chest can be done, but makes it so that you can't take your shirt off at the beach. So usually a better trade-off, rather than having tight skin afterwards, is to have the skin a little bit looser so it looks like somebody lost weight, kind of a dad bod, a dad bod look instead of a bodybuilder look. So patients in their 40s, 50s, 60s are going to have more of a dad bod, but they're still happy because they don't look like a man with breasts, and they can take their shirt off at the beach. You can make the chest flatter by excising extra skin, but then they can't take their shirt off at the beach. So for most of my patients, that's not a good trade-off. Some patients that have had bariatric surgery, gastric bypass, have so much loose skin that will actually excise skin. And really, I spend a lot of time with them looking at the scars so they really understand that. But I'm going to say that 95% of the time, people rather have a little bit of loose skin and look like a dad bod without breasts, rather than have a visible scar on the chest.
Yeah, definitely. And when they're just doing purely the liposuction, the scarring from that's pretty minimal as well.
Yeah, so it's hard to tell going to the operating room whether somebody is just fat or just breast tissue. And I've guessed wrong before early in my practice, where I thought it was just fat, and then they had some breast tissue that grew back, and I had to go back with a second operation and excise breast tissue. So nobody wants two operations when they can have one operation. So I err on the side of removing that tissue. So I'll get there during surgery, and sometimes with liposuction. Usually you can kind of tell a little bit beforehand, but if it's completely flat and we kind of pinch and roll and smooth the skin and there's no tissue left, then liposuction. But interestingly, the incision from liposuction is usually kind of in the axillary line, and that you see a little bit more if you look for it, but it's hidden in the armpit area. The incision that's around the areola, if you have to make it bigger, usually almost always heals beautifully anyway. So I don't hesitate. I'll err on the side of making that incision and taking out that breast tissue, because we don't want to come back and do a second operation if we don't need to do that. And I'm going to say that in my practice, probably 85% of the time, people have some breast tissue to be excised as well.